Hi there, welcome to our Better Health Together series. You'll see with me today are two guests who are going to talk about multidisciplinary care in general practice. This is important because not only is it part of the reform agenda, you've actually been working this way and incrementally moving towards multidisciplinary care already, so foreground of change. What does it mean for your practice, first part? And secondly, what does it look like? What does it feel like in the practice day to day?
So I think for our practice, what it means is that we can really comprehensively address patient need on a much larger scale, which we possibly wouldn't be able to do if we were just working alone. I think that's probably the core of it, because our patient population is largely underprivileged, Aboriginal health, homeless health, cultural and linguistically diverse. A lot of these people aren't able to access care quite regularly and also have very complex needs. So working as a sole GP with that cohort is really challenging, because it's not just about the medical care, it's about psychosocial, societal, home, housing, familial issues. So a lot of that cannot be addressed in a single consult.
I think multidisciplinary care means a group of different health professionals from different disciplines collaborating together to achieve the same goal for the patient. So I think a lot of people see multidisciplinary care as just different professionals all being involved in the patient's care. But for us, it means collaboration and coming together as a team to be all contributing towards one goal and working together. And I think that's the key, is that we're working as a team to improve the outcome for the patient, and having everybody work at their top of scope so that we have the right person at the right time involved in the patient's care. And it kind of was born for us out of survival mode. We don't have enough GPs to see the volume of patients that we have in the practice. And unless we were willing to work in a different way and bring different health professionals into the patient's journey and all working together, we just didn't have the capacity to meet the needs of the patient.
But you've done two things, and some of it may have been a bit unwitting, but for people in marginalised communities, health literacy and navigation is complex. So doing multidisciplinary care within the practice enables people to access allied health professionals that they may not have otherwise. And so that's one thing. But the other thing is it gives you this diversity of clinical and allied health views around patient care, and there's multiple benefits.
Yeah, it increases the accessibility, I think, because for us, we have all of these different disciplines under one roof. So we don't need the patient to attend lots of different locations and take time from their busy schedules to make an appointment with one person that then doesn't align with another person. It's all under one roof, so it's that accessibility. But it also means that we're not duplicating care, and we've got one person doing, for example, observations that's then shared between the whole team. So you don't have each health professional doing their own blood pressure multiple times, or the patient having to tell their story multiple times. You can all communicate, get the background information, and just do the part of the care that's needed. So you're saving time and you're working more efficiently.
Is there an example that you can think of that this way of working in your practice has really demonstrated the health benefit and outcome to a patient?
We were having a discussion about this. It was very difficult for us to pick a specific example. There's been hundreds of patients that would probably have benefited from this situation, but I think one that happened most recently was a very poorly controlled diabetic patient of ours. She's in her mid-50s and she was coming to see me for her sugar control, and she's a very busy person. She's working FIFO type work, so she doesn't get time to actually come and address her issues. I was managing her sugars, I was managing her general care, doing healthcare plans on her, making sure that she's trying to access allied health as possible. But we never actually got much detail apart from coming in, get your sugars checked, get your blood checked, let's talk about your weight, let's talk about how you're going, how's your mental health, quick chat, and leave. She finally actually did engage with our multidisciplinary team. So on one day she saw the podiatrist, the pharmacist, the exercise physiologist, and the chiropractor was also involved in our practice. It happened to be a day when we had our case conferences, which happens on a Wednesday. In the discussion in the case conferences regarding the patient, I learnt so much. I didn't know that the patient actually was having bilateral peripheral neuropathy, which is when she can't feel the bottom of her feet. She wasn't telling me that, and I hadn't thought to ask her about it. So she was actually at a high risk for heat injuries if she was exposed to heat. She was wearing steel cap boots, her foot health wasn't good. That then led on to the podiatrist explaining that she was actually experiencing pain up this part of her leg, which then led to the exercise physiologist saying, oh yeah, actually she did mention that to me. We actually think it's from the sciatic region. The chiropractor then put in her 2 cents worth. With that as a background, the pharmacist then had a look at her medications and said, well, look, her blood sugar control is not well managed on the insulin that she's on. Shall we just change it to this one instead? And then we put in a plan for follow-up. So that all took place in a 15-minute case conference.
That's a great example.
Yeah, it was really, really good. And that's just aside from other things that she has going on, including some social issues, which she will come and see our social worker for. So this is an example of a patient that's willing to engage as well. So that's one of the challenges we do find. Because it's so opportunistic, we will catch patients do something like this and then they may be lost to follow up for quite a long period of time. So because we have really wonderful nurses and receptionists, we can put a recall system in and try our best to catch them. But we do have a register of patients that are high risk, that if they do come in, it'll be flagged and say, oh, she's back. Quickly, let's do something about it.
So we'll all jump and we'll wrap the care around her. What do you think impedes a patient taking up the offering of the multidisciplinary care? Is there something that gets in the way?
I mean, I think the consults take longer in the way that we manage the multidisciplinary team. Patients sit and wait in the waiting room for sometimes an hour or two, and in that time they might see 5 different health professionals, and not everyone has the luxury of time to dedicate to their health in that one block.
I think also in our case, Dr. Raji, who's our founding GP, my mum, she's got such a wonderful following with the patients and they will really listen to her. So there's a lot of patience that the patients provide because she will say so. She'll say, a lot of tolerance. She'll say, no, just wait. Got to get your eyes checked with the optometrist, and after that the foot check, okay? Make sure you do that and I'll see you after that, and then we're going to get the pharmacist to quickly chat with you, and they'll just be like, okay. Yeah, I'll do it if you say so. So it works well.
It's the trusted relationship as well, is it not? And people like to have, or in fact value, the trusted relationship with their GP.
And I think having a GP who explains why they might need to see a whole heap of different health professionals, why you might need an exercise physiologist involved in your care and what benefit you'll get out of seeing them, and taking the opportunity to get your eyes checked and what impact that will have on your overall health. So it's not just go and see all these people because I don't have the time for you, or I want someone else to do parts of the job that I can't do. It's these people are really going to improve your health outcomes, and this is the benefit for you and the benefit for me, and yeah.
So thinking about those practices that are about to embark on a journey of multidisciplinary care inside their practice, what are some of the tips or clues you would say they need to start to think about to prepare the ground for that transition to that model?
I think patience is a huge issue. So you need to be a little bit open-minded and be ready to accept that perhaps it won't function as per a normal GP practice. So you may not have your set bookings that will run to time. Yes. Of course, it depends on the patient cohort, whether they do come on time. A lot of ours don't. But just being aware that you're going to educate the patients that each consultation will take longer, that you will be seeing multiple people, and that you might need to invest that time into your consultation. So I think that's one huge thing, to be ready and aware.
So a different way for the GP in and of themselves to change their own practices in situ.
And also to be aware that you're not the boss, you're going to be part of a team. Yes. So I think there's quite a traditional GP outlook that, you know, I have the last word, or you should do what I say, or, you know, I think that's changing a lot nowadays. Yes. And when you realise that you're not just working alone, as you said, previously it's more fun, it's definitely more collegiate, there's more conversation about it, and you learn so much from your colleagues. Kate is a pharmacist herself, and a lot of the time I'll be asking her for advice on certain things. So like, it's always good to accept that you don't know everything and that you can just contribute to the care of the patient as well.
So patience is one takeaway.
Yes.
I think it also takes a bit of the daunting feeling off that you don't have to know everything as well. You don't have to be the expert in every single area. You have always referred to other specialists, and now you're bringing specialists in different ways into your own practice, and that makes your job easier. It means the patient outcomes are better, they're faster, and you don't have the sole responsibility of having to pick up absolutely everything.
So, one last tip, Kate, for those practices about to try multidisciplinary care. One last tip from you.
Every interaction you have with different health professionals, you have the opportunity to start your multidisciplinary journey.
Yes.
They don't have to work for you. You don't have to be paying them a salary. They don't have to be under your roof to be you're coming together and working as a team. That's all you have to, the only way you have to look at it. So if you like working with other people, I think that you will really enjoy working in a multidisciplinary general practice.
So the takeaway there is think about the longer outcome here, which is about enjoyable work, rewarding work,
Yes.
and better patient outcomes ultimately.
Yes.
So multidisciplinary team care, WAFA is committed to enabling this where we can, and we'll be working hard with other practices, but you are a model practice in this regard and, you know, really at the forefront. So I know you're not alone, not the only practice in WA, but definitely one of them able to showcase this under one roof, which I think is a credit to both of you and your mother, of course. Let's not
It was her
forget
vision, yes.
It was her vision and she was right on to it. So thank you both very much, and stay tuned. We'll be doing lots more on multidisciplinary team care as we go forward. Bye for now.